Hey everybody, my name is Isaiah. Today I'm going to tell you about my Persuasive topics explanation today. This is about the universal healthcare speech explanation, so I'm going to get started. So my topic explanation: timely healthcare costs in the U.S. continue to rise, with millions uninsured or underserved. The debate over healthcare reform is ongoing, especially after recent discussions around inflation, Medicare expansion, and private insurance eliminations. According to the Kaiser Family Foundation 2024, about 31 million Americans were insured in 2023, highlighting the urgent need for reform. Controversial. Universal health care sparks debate because it the challenged the private insurance model and involves increased government spending. Critics argue it could lead to higher taxes, longer wait times, or reduced innovation, while supporters claim it ensures healthcare as a human right and reduces systemic inequality. Okay, gotta slow down. Sorry about that. Impactful universal healthcare will affect millions of Americans' daily lives, ensuring access to doctors, preventive care, and medications. It also impacts society by reducing medical bankrupt bankruptcies, improving public health outcomes, and possibly lowering overall healthcare costs through preventive care. Script and introduction, attention grabber. Imagine being diagnosed with a serious illness, but being unable to see a doctor because of the cost. Sadly, this is reality for millions of Americans today. Intentions. My goal today is to persuade you that the United States should move toward a universal healthcare system. Statement preview. Specifically, I will show that universal healthcare is necessary because it reduces financial burdens on families, improve public health outcomes, and creates a fairer and more equitable society body. Main point number one: reduce financial burdens. Evidence: millions of Americans face medical debt or bankruptcy due to high healthcare costs. American Medical Association 2023 explanation: universal healthcare will eliminate most of pocket costs, protecting families from financial ruin. Example: countries like Canada and Germany provide coverage for all citizens, dramatically reducing medical debt. Main point number two: improves public health outcomes. Evidence access to preventive care leads to early detection of disease, reducing mortality rates. World Health Organization 2024. Explanations: when everyone can access doctors and medications, overall population health improves and public health crises are easier to manage. Example: universal vaccinations programs in countries with universal healthcare have higher vaccination rates and lower infection disease spread. Main point three: creates a fairer and more equitable society. Yeah, slow down. Socioeconomic disparities, dispart, dispar, disparities in healthcare access are stark in the U.S. Low-income families and marginalized communities are disproportionately insured. Cashier Family Foundation 2024 explanation: universal healthcare ensures everyone, regardless of income or background, can receive care, promoting social justice. Example: in the U.S., universal healthcare could reduce disparities in marital mortality, chronic disease and disease management. Excuse me. Let me try this again. Example: in the U.S., universal healthcare could reduce disparities in marital mortality, chronic disease management, and access to mental health services. Conclusion: restate of my main points. Universal healthcare would protect families from financial hardship, improve overall public health, and ensure fairness across society. Call to action as citizens, we must support policies that move the U.S. toward universal health care. Is not a privilege, it's a human right. Closing thought. Imagine a nation where no one has to choose between paying rent or seeing a doctor. That is the future universal healthcare can offer, and it's a future worth fighting for. The end. All right. This is my that's my Persuasive topic explanation today. Got all my got everything I need. That's it. Peace out.